we will be learning about enteric fever. So enteric fever is caused by two species of the salmonella, Salmonella typhi and paratyphi. Paratyphi has further subtypes A, B and C. So they they are they typically cause the typhoid fever. So typhoid fever caused by the Salmonella typhi. Now what happens is that, as the name suggests, firstly the patient suffers from fever, and the type of the fever is the step ladder type of fever. That is, the fever increases then again decreases. Now bradycardia, that is slow heart rate. Bradycardia is seen, slow heart rate. And toxemia, that is toxicity, is seen in the blood. Again, firstly there is the occurrence of fever, but if the condition is worsened, then it may also be fatal, that is death may occur. Now the major characteristics are hepatomegaly, that is inflammation of the liver, and splenomegaly or palpable spleen, that is the spleen becomes soft. Now rose spots are the most important features. So if a person has a typhoid fever, then what happens is that rose spots are seen in the chest and the abdominal area. So rose spots in the chest and the abdominal area suggests the typhoid fever, abdominal region. Now leukopenia is seen. Incubation period is 7 to 14 days. Now what are the complications? Complications is intestinal perforation, that is it may perforate or cause injury to the intestine. And constipation, hemorrhage, circulatory collapse, bronchitis, psychosis means loss from the reality, periostitis means, so some difficult terms are psychosis, that is loss of contact from the reality. That means, for example, if a person is if a patient comes to hospital, if we ask them where are you now, they may say that I don't know. So loss from reality is psychosis. And another one is periostitis. So the term ostitis means ostitis means inflammation of the periosteum. Periosteum means the outer covering of the bone. Now we'll come to paratyphoid fever. So paratyphoid fever is caused by Salmonella paratyphi, and paratyphi is relatively less dangerous than typhoid, and the symptoms are also less dangerous. And its duration, previously typhoid had Salmonella Salmonella typhi caused the incubation period of 7 to 14 days, but for paratyphoid fever the incubation period by the paratyphoid bacilli is less than 7 to 14 days, shorter duration of incubation. Now we'll come to the lab diagnosis of the enteric fever. So it includes first, second, third and fourth weeks. Now this is popular. First one is the blood culture, then the antibody test. S stands for the stool culture, and then the urine culture. So before the antibiotic treatment for the salmonella is given, we should conduct the test in this week duration. So during the first week, blood sample is analyzed. Second week, antibody test is also called as Widal test and stool test, and finally urine test. Now first coming to the blood culture. So before the antibiotic treatment for enteric fever is given, we will get the positive test for the blood culture. In the first week, if we conduct the blood culture, then the chance for the positivity for the blood culture, right, is 90%. For second week, we have positivity as 75%. For the third week, we have 60%. And for the fourth week, we have 25% chance of positivity. Now, venipuncture is done. 5 to 10 milliliter of the blood is extracted from the median cubital vein. So from the median cubital vein, blood sample is taken out and analyzed. And if we store the blood for long duration, then the clotting of the blood may occur, right? So if we store the blood for longer duration, the blood may form clots. So to break this clot, an enzyme called streptokinase is used so that culture can be done systematically. Now, uh, now different agar which are used for its culture. So some of the agar used are McConkey agar, DCA agar or deoxycholate agar. So this one now. Now, as it is the non-lactose fermenting bacteria, so for McConkey agar, what happens is that colorless colonies are seen. Colorless colonies are seen because it is non-lactose forming. So if it was lactose fermenting, then pink colonies would be seen, but here as it is non-lactose fermenting, colorless colonies are seen. Now, Cysteneda method is more common or more preferable for its diagnosis because Cysteneda bottle has brain-heart infusion. Brain-heart infusion. Castaneda bottle, okay? It has brain-heart infusion. It is the mixture of solid and liquid medium. And further, so it reduces the risk of contamination. So this method reduces the risk of the contamination. Now, stool culture. Stool culture. So for stool culture, salmonella are stayed in the stool. So same agar medium, McConkey agar and DCA agar is used, and urine culture in the fourth week. But for urine culture, it is considered less effective than the stool culture. So stool culture is more preferable. Salmonella is non-hemolytic in nature in the blood agar. Now for the chronic carrier, if the person is a chronic carrier, then this bacilli may be seen in the gallbladder. So bile pigment test can be done. If there is the presence of the bacteria in the gallbladder, then we will consider the person as the chronic carrier of the salmonella bacteria. Now we'll come to identification. So gram negative. So what are its characteristics? In the gram staining, we will see that it is gram negative. It is non-sporing and it is non-capsulated. Now in the McConkey agar, we will see that it is non-lactose fermenting. Now further we will see that this bacteria is peritrichous in nature, that is flagella is around its whole body. Now selective media. Wilson and Blair media is considered the selective media for the Salmonella species. As this bacteria produces the H2S gas, so it gives the black color. This is the Wilson and Blair media. Now we will come to biochemical reactions. So biochemical reactions are simply remembered as IMVIC, minus plus minus plus. So I stands for indole test, M stands for methyl red test, V stands for Vogt-Proskauer test, and C stands for citrate test. Now what we will do is that it is also urease negative. Now we will do the Widal test for the antibody. So for the Widal test, we will see the antigen antibody reaction or agglutination reaction within the interval of 7 to 10 days. This is called as the Widal test. Now we will come to procedure. Okay. For the procedure, we will take 4 different test tubes. Now in these 4 different test tubes, 4 antigens are used. So each test tube has 4 same antigens. Now serial two-fold dilution of the serum, that is 1 by 20, 1 by 40, 1 by 1 by starting from 10, 1 by 10, 1 by 20, 1 by 30, 1 by 40. So dilution is done in all the 4 test tubes. Now what happens is that volumes of antigen, equal volumes of antigens, and then added to respective rows. Then observation is H agglutination, loose cottony woolly clumps are formed. O agglutination, granular disc-like bottoms are formed. So after incubation in these test tubes for temperature of 37 degree and time interval of 4 hours, after dilution has been done in these respective test tubes, what we will see is that somewhere granular discs are formed and somewhere cottony ball appearance can be seen. So if there is the cotton woolly clumps, then there is H agglutination. So if there is cottony woolly appearance, then there is H agglutination. And if there is O agglutination, which is more common, then granular disc-like shape can be seen at the bottom. So this one is at the bottom of the test tube. Now interpretation. So rise in the titre is the titra is more important to be studied. Basically there is four times or four folds rise in the titre, that is test tubes. Now this rise is 100 times for the O antigen and 200 times for the H antigen. This rise in the titre. Now identification characteristics. So this one is not important. Means carriers can be convalescent carriers or healthy carriers. They can excrete organism in the feces. 2 months to a year. Repeated stool culture, bile culture must be done. Detection of the antibody to antigen. So basically it is written how infection and all occur. Now we'll come to different vaccines which are included for different species of the bacilli. For the killed type S. typhi or salmonella typhi, we use the TAB vaccine. And for live typhoid, right? For live typhoid vaccine, we use the Ty21A vaccine. Now, another vaccine is the purified polysaccharide vaccine. So these are the three vaccines: killed S. typhi vaccine or the TAB vaccine, live typhoid vaccine or Ty21A vaccine, and purified polysaccharide vaccine. Thank you.